Hi, I'm Dr. Rick Duplantis, and you're watching It's Your Health. I hope you've been enjoying this beautiful weather we've been having lately, these beautiful sunny days with low humidity, perfect for exercising outdoors, jogging, walking, just getting some sunshine outdoors in this beautiful low humid time we're having. I've been away from the show, or from taping actually. I taped several shows in advance, and been away from actually taping due to surgery I had on my wrist for what's called a TFCC tear in the right hand, in the wrist. This stands for triangular fibrocartilage tear in the right hand, my wrist. That's my dominant hand, and I'm at this time about 6 weeks out from surgery and doing quite well at this point. Tonight's show is about a very common neurological problem called carpal tunnel syndrome. A lot of people have this problem. And it's quite painful and quite an aggravation. Carpal tunnel syndrome causes pain and tingling and numbness in your hand, and it's from the pressure of the median nerve in your wrist. Things like illnesses, pregnancy, and obesity can cause carpal tunnel syndrome. Oftentimes rest and exercise may help to relieve these symptoms of this condition. Now, if you're feeling numbness, tingling, or weakness in your hand, you might want to consider asking your doctor to check you out for this syndrome called carpal tunnel syndrome. Like I said, it's caused by this pressure of the median nerve, which runs the length of the arm. It goes through a passage in the wrist called the carpal tunnel, thus the name, and it ends in the hand. Now, the median nerve controls the movement and feeling of your thumb, and also the movement of all fingers except your pinky. The carpal tunnel is narrowed as a result of usually from swelling in the flexor retinaculum compartment. Carpal tunnel syndrome, oftentimes people don't know what brought on their condition, but it can happen due to a lot of different things. Number one, carpal tunnel syndrome can be brought on by repetitive motions like typing or any motions of the wrist that you do over and over again. This is especially true in actions when your hands are lower than your wrist. A lot of times from typing at a computer or using a mouse, of course, can cause carpal tunnel syndrome. There are many adjustments you can make to your keyboard by having a pad in front of your keyboard where you're resting your wrist on, and this will prevent carpal tunnel syndrome. Conditions like hypothyroidism, obesity, rheumatoid arthritis, and diabetes, and even pregnancy can bring about the development of carpal tunnel syndrome, the condition. Okay, I want to take a brief break right here. My director's giving me a signal here time for a station break. So at this point, we'll take a short break and we'll be right back. Hi, I'm Dr. Rick Duplantis, and today we're talking about strawberries. The health benefits of strawberries are many. Strawberries are a superfood. In addition to antioxidants, polyphenols, they have many other nutrients, vitamins, and minerals that contribute to the overall health benefits of these berries. Now, these nutrients include vitamin C, folate, potassium, manganese, dietary fiber, and magnesium. A Harvard study found that regular consumption of anthocyanins, a class of flavonoids found in the berries, can reduce the risk of a heart attack by 32% in young and middle-aged women. The women who consumed at least 3 servings of strawberries or blueberries per week fared best, according to a lead study by a Dr. Cassidy, nutritionist at the Norwich Medical School in the United Kingdom. The flavonoid quercetin contained in strawberries is a natural anti-inflammatory that appears Hi, I'm Dr. Rick Duplantis, and today we're talking about strawberries. The health benefits of strawberries are many. Strawberries are a superfood. In addition to antioxidants, polyphenols, they have many other nutrients, vitamins, and minerals that contribute to the overall health benefits of these berries. Now, these nutrients include vitamin C, folate, potassium, manganese, dietary fiber, and magnesium. A Harvard study found that regular consumption of anthocyanins, a class of flavonoids found in the berries, can reduce the risk of a heart attack by 32% in young and middle-aged women. The women who consumed at least 3 servings of strawberries or blueberries per week fared best, according to a lead study by Dr. Cassidy, nutritionist at the Norwich Medical School in the United Kingdom. The flavonoid quercetin contained in strawberries is a natural anti-inflammatory that appears. Hi, I'm Dr. Rick Duplantis, and today we're talking about strawberries. The health benefits of strawberries are many. Strawberries are a superfood. In addition to antioxidants, polyphenols, they have many other nutrients, vitamins, and minerals that contribute to the overall health benefits of these berries. Now, these nutrients include vitamin C, folate, potassium, manganese, dietary fiber, and magnesium. A Harvard study found that regular consumption of anthocyanins, a class of flavonoids found in the berries, can reduce the risk of a heart attack by 32% in young and middle-aged women. The women who consumed at least 3 servings of strawberries or blueberries per week fared best, according to a lead study by Dr. Cassidy, nutritionist at the Norwich Medical School in the United Kingdom. The flavonoid quercetin contained in strawberries is a natural anti-inflammatory that appears to reduce the risk of atherosclerosis and protect against the damage caused by low-density lipoprotein, LDL cholesterol, the bad cholesterol found in humans. Due to their high potassium content, strawberries are recommended to those with high blood pressure to help negate the effects of sodium in the body. A low potassium intake is just a big risk factor for developing high blood pressure, as is a high sodium intake. I'm Dr. Rick Duplantis. Have a great day. Okay, I'm Dr. Rick Duplantis. You're watching It's Your Health, and we're back. Topic of the night, if you're joining us late, is carpal tunnel syndrome. If you have carpal tunnel syndrome and you're not treated for it, it's a syndrome that lasts a long time, actually. It can get worse. It can even go away and return from time to time. So when you diagnose this early, it's easy to treat carpal tunnel syndrome rather than waiting a long period of time. So I guess we'll talk about how do you detect carpal tunnel syndrome. When do you know if you have it? With carpal tunnel syndrome, you may feel a burning, a tingling, or an itching. This numbness in the palm of your hand and the thumb or index and middle fingers will be affected. You might first notice that your fingers fall asleep and become numb at night. Now, that usually happens in the evening because of the relaxed position of your hand while sleeping. In the morning, you might wake up with numbness and tingling in your hand that may run all the way down from the wrist and then all the way up to the shoulder. So these are some of the signs of carpal tunnel syndrome. Now, the early signs, typically, the symptoms start out slowly. It might even start with burning or numbness. Then tingling may come on, and you may have pain in the hand. You might feel it in your thumb and any of your fingers, but like I said, it's not in the 5th digit of the hand. It's never seen there. You don't have any tingling there. The strange feeling may also travel up your forearm at times. Often symptoms start at night. Like I said, that's because most people sleep with their wrist bent, thus compromising the carpal tunnel and causing compression of the carpal tunnel nerve. This causes pressure on the median nerve, and thus you might wake up feeling like you need to shake your hands out because of this carpal tunnel feeling. As your condition gets worse, you may notice symptoms during the day as well as in the night. Now, this often happens when you're doing something where your wrist is bent or in flexion or down for a long time, like driving a car, reading a newspaper, or even holding your phone. In severe cases, as carpal tunnel syndrome becomes more severe, you may have less grip strength, because the muscles in your hand shrink. Your grip strength will be noticeably decreased. You'll have pain and muscle cramping. This will also become worse with time. The median nerve begins to lose function because of this irritation and the pressure around it. This can lead to several things. Slower nerve impulses in the median nerve can lead to loss of feeling in the fingers, and a loss of strength and coordination as well, especially the ability to use your thumb to pinch. Oddly enough, you can end up with permanent muscle damage and lose function in your hand. So don't neglect seeing a doctor. Don't put it off. Given that carpal tunnel syndrome is associated with low aerobic fitness and an increased BMI, which is obesity and overweightness, it makes some inherent sense to provide the patient with an aerobic fitness and weight loss program. Stationary biking, cycling, or any other exercise that puts strain on the wrist probably should be avoided. The use of modalities, particular therapeutic ultrasound, may provide a short-term relief of some patients' symptoms in carpal tunnel. There's a study that was done and indicated that in patients with mild to moderate carpal tunnel syndrome, treatment with shortwave diathermy can produce significant short-term benefits, including the alleviation of the clinical symptoms and pain. This brings about improvement of the hand function as well. In a prospective randomized controlled double-blind trial, 31 patients with mild to moderate carpal tunnel syndrome were treated with a combination of hot pack, nerve tendon gliding exercises, and even placebo, undergoing this therapy 5 times per week for 3 weeks. A variety of evaluation measures, including the Tunnell sign, Phelan's sign, carpal tunnel compression test, and the Boston Carpal Tunnel questionnaires for severity and functional status scales, were used to assess the patient's outcome. The results are that the significant improvements were found in the patients who underwent the therapy and those who received a placebo treatment. Additionally, yoga and carpal bone mobilization techniques have some weak evidence in reducing the symptoms of short-term carpal tunnel syndrome. Wrist splints with the wrist joint in the neutral or slight extension to be worn at nighttime for a minimum of 3 to 4 weeks have had some evidence for improving carpal tunnel syndrome. Certainly, they are low cost and they have a very low risk of adverse effects as initial therapy. There's no evidence that suggests that a specific stretching or strengthening program for the hand and wrist is used for treating carpal tunnel syndrome. However, massage or nerve glide type techniques offer no proven benefit as well. Worksite ergonomic assessment, equipment, and or positioning seem to not provide any benefit as well in patients with carpal tunnel syndrome. Accordingly, electrophysiological data respond to conservative management, usually consisting of, you might want to splint the wrist at nighttime for a minimum of 3 weeks. Many off-the-shelf wrist splints seem to work well, although theoretically, a custom-made splint in neutral position is probably the best choice, something that your doctor can provide for you. Steroid injections into the carpal tunnel has been shown to be of long-term benefit and can be tried if more conservative treatments have failed. Now, these injections may also be worthwhile prior to surgical management or in cases where surgery is relatively contraindicated, and such a case would be pregnancy. Ultrasound measurements of the median nerve can help predict the response to steroid injections. We also have the non-steroidal anti-inflammatory drugs, the NSAIDs, and or diuretics may even be of benefit in certain populations. Patients who have fluid retention, and also those with wrist flexor tendonitis. Another compound may be of help and natural is B6 and B12 supplements. Some people have tried them, but overall we look back at the research and they have been negative. There are many risk factors. Like I said, the fluid retention and obesity is another risk factor for carpal tunnel syndrome. Sometimes, surgical intervention may be needed to control the symptoms. Patients whose conditions does not improve following conservative treatment and patients who initially are in severe carpal tunnel syndrome category as defined by electrophysiological testing should be considered for surgery. Now, the surgical release of the transverse ligament provides a high initial success rate, greater than 90% in the treatment of carpal tunnel syndrome. They have a very low rate of complication. However, it has been suggested that long-term success rate may be much lower than previously thought. Success rates are also considerably lower for individuals with normal electrophysiological studies. Thus the need for performing electrophysiological studies prior to considering surgery. When I have a patient with a carpal tunnel syndrome, I may refer those patients with carpal tunnel syndrome to specialists trained clinically in such as neurophysiology, a neurologist, physiatrists, physical medicine doctors, and rehabilitation specialists for possible electrophysiological studies and specific rehab. These test results are important for the diagnosis, instigation of appropriate treatment, and the determination of prognosis and long-term follow-up. Techniques and devices to stretch or manipulate the carpal tunnel have shown some promise, but still are not accepted widely. Medication in summary, regular use of non-steroidal anti-inflammatory drugs, NSAIDs, can be a benefit if there's a suggestion of inflammation in the wrist region. Something like flexor tendinosynovitis or rheumatoid arthritis, they may be effective. Likewise, if you have edema, and if that's thought to be prominent, and then a short course of a mild diuretic may be a benefit in treating your carpal tunnel syndrome. I want to let you know that, there's a lot of information that you might find on carpal tunnel syndrome. You can Google that on the internet. There's a great deal of information, clinical studies on carpal tunnel syndrome. Like I said, the carpal tunnel syndrome, it's a collection of characteristic symptoms and signs that occur following compression of the median nerve within the carpal tunnel. Now, usually these symptoms include numbness, paresthesia, which is pins and needles sensations in your hand, and pain in the median nerve distribution, which would be the palm of the hand or the thumb and the fingers, with the exception of the fifth digit. These symptoms may or may not be accompanied by objective changes in sensation and strength of the median nerve structures of the hand, but until the advent of electrophysiological testing back in the 1940s, carpal tunnel syndrome commonly was thought to be the result of compression of the brachial plexus by a cervical rib or other structures in the anterior neck region. It is now known that the median nerve is damaged within this rigid confines of the carpal tunnel, initially undergoing demyelination, followed by degeneration of the nerve itself. Sensory fibers often are affected first, followed by motor fibers. The autonomic nerve fibers carried in the median nerve may also be affected. The cause of damage is subject to some debate. However, it's seeming that abnormal high carpal tunnel pressures exist in patients with carpal tunnel syndrome. Now, this pressure causes obstruction to the venous outflow back pressure and causes edema formation and ultimately ischemia in the median nerve. Now, the risk of developing carpal tunnel syndrome appears to be associated, at least in part, with a number of different epidemiological factors, including genetic, medical, social, vocational, avocational, and demographic. A complex interaction probably exists between some or all of these factors, eventually leading to the development of carpal tunnel syndrome. Definite causative factors are far from clear in the development of carpal tunnel syndrome. Now, the incidence of carpal tunnel syndrome is 13 cases per 1,000 subjects per year. Prevalence is approximately 50 cases per 1,000, and this is in the general population. The incidence may rise as high as 150 cases per 1,000 subjects per year, with the prevalence rates greater than 500 cases per 1,000 subjects in certain high-risk groups. A paucity of population-based studies of carpal tunnel syndrome exists. However, the incidence and prevalence in developed countries seems familiar or similar to that of the United States. The incidence in the Netherlands is approximately 2.5 cases per 1,000 subjects per year. The prevalence in the United Kingdom, is 70 cases per 1,000. Carpal tunnel syndrome is almost unheard of in some developing countries among non-white South Africans. Carpal tunnel syndrome is not fatal, but it can lead to complete irreversible median nerve damage with a consequent severe loss of hand function if left untreated. So don't delay. If you feel like you have carpal tunnel syndrome, see your physician right away. For as race, the white population has the highest risk of developing carpal tunnel syndrome. The syndrome appears to be very rare in some racial groups, such as the non-white South Africans. In North America, the white U.S. Navy personnel have carpal tunnel syndrome at least at a rate of 23 times that of the black personnel. For sex differentiation, the female to male ratio for carpal syndrome is 3 to 1. The peak age range for developing carpal tunnel syndrome is about 45 to 60 years of age. Only 10% of patients with carpal tunnel syndrome are younger than 31 years of age. I hope this information on carpal tunnel syndrome has helped you, been a benefit. If you start developing these symptoms, remember, folks, you want to see your physician right away because, damage to the median nerve can be serious and it can be irreversible. So if you're getting tingling in your hand, weakness and numbness in your thumb and your fingers, see your doctor right away and get this checked out. I'm Dr. Rick Duplantis. I hope you've enjoyed the show tonight. I hope you'll continue to tune in to our show, It's Your Health, every week on Monday nights at 8 p.m. on channel Cox Cable 16. Have a good evening. God bless.